Good afternoon and welcome to Your Health is Wealth. I'm your host, Dr. Stephen Katz, alongside my co-host, Dr. Loreena Ryder. We're here to help navigate your journey to wellness, but we like to do it simply without all of that horrible medical terminology that everybody hates. We're here to provide practical solutions to your health issues that allow your body's healing systems to do the work for you. It's simple, it's natural, and it works. If you're still struggling with your health, you can come see us at Naturopathic Physicians Group to help get your life back.
Topic of the day today is diabetes, also called type 2 diabetes mellitus. So we have a lot of information to talk about. This is a huge problem in the United States.
Huge.
Very big. And so we really won't be discussing anything about type 1 diabetes. This is all going to be the lifestyle, later in life diabetes type 2. Some of the symptoms that you might experience. Let's go right into that. So normal symptoms, if you have type 2 diabetes and nobody has told you yet, you might be experiencing increased urination, increased thirst, increased appetite, and definitely sugar cravings.
Sugar cravings is a key to a lot of different conditions out there. Most people will say, I have sugar and cravings all the time. That does not mean you have diabetes, but it's real cravings. You're thinking about sugar all the time because as your blood sugar is dropping, because your body, since you have diabetes and your body needs a certain level of sugar to maintain its function, it will be screaming at you saying, give me more sugar, which is also, unfortunately, the worst thing you could possibly do if you're trying to get rid of it. However, yeah, it's real, but it can affect your eyes. One of the biggest, I guess the two areas that long-term diabetes really does damage is your kidneys and your eyesight. But of course, it can kill you in other ways as well. But blurry vision, floaters can definitely cause blindness. And you can also get numbness and tingling. Neuropathy is a very common long-term associated part of diabetes.
Yeah, and the numbness and tingling can turn permanent, unfortunately. So you really need to get a handle on this in the early stages. You might also experience some weakness and fatigue along with the diabetes. Also, diabetes tends to weaken your immune system. It slows the fighting off of the infections ability of our body. That's the sugar you can thank for that.
Yeah, sugar feeds pathogens. We've said that on this show many times. And so if you have high amounts of sugar, it's basically like a breeding ground for all of those pathogens. So when you get sick, you have a harder time fighting the infection. And this will happen when you get wounds, because a lot of the people have seen people with diabetes where they have a lot of wounds on their leg, or they'll have ulcers on their leg. And when that happens, it's partly because of the infection, but it's also because the body has a very hard time fighting that infection because of all the sugar in there.
Yeah. Long term, this might affect your memory. Now, this has been, you've heard dementia maybe as another name of type 3 diabetes. It's something that tends to show up when diabetes goes long term. You have issues with memory. There's a huge correlation with Alzheimer's. Dementia is just a portion of that or the early sign of it. So yeah, if you ever hear anybody refer to something called type 3 diabetes, they're talking about what's affecting the brain.
Yeah, and just because you have memory loss as you age does not mean you have diabetes either, but they have done studies on this, and it shows up when someone has uncontrolled blood sugar issues or diagnosed with diabetes type 2, Alzheimer's is creeping around the corner for those people. And I'm sure a lot of you listening out there are probably like, oh yeah, my parent had diabetes, and yes, they ended up getting Alzheimer's. It's a very real correlation and connection. But the retinopathy and the blindness, so problems with your vision, long-term for sure, and of course that diabetic neuropathy, so the numbness, the pins and needles, a lot of it also has to do with blood flow. As if you're getting that restriction and that inflammation in the vessels, this tends to be worse in the legs than the arms, but it can happen in any of the extremities.
You can even get to the point where diabetes has affected your body so much that you may lose limbs due to infection and necrosis. It's very sad to see that happen. Kidney disease, I think we mentioned already, is a long-term consequence of diabetes type 2.
And of course, if you do have kidney disease caused by diabetes, you're not likely going to get a kidney transplant. So trying to get on that list is not easy if you have a condition that's causing the damage to the kidneys. Much like if an alcoholic is about to lose their liver due to cirrhosis, they're not likely going to be getting any liver transplant, because if it's a causative agent that you did to your body, you're not likely going to get high up on that list for organ transplant. So in order to avoid needing a new kidney, in order to avoid needing a new liver, and surviving and saving your legs, you might want to take care of your diabetes correctly if you do have it.
If you have old school parents, they told you to take care of what you have. That includes your organs.
Take care of your organs. Most people don't get extras.
Yeah.
And even if you do, if you're lucky enough to get the extra, they have shelf lives. So if you're a young person and you're like 35 and you're getting a new organ, you're likely going to need another new one when you're like 50, 55. So if you want that long, healthy life, save your organs.
Yeah.
Versus on the conventional side, they like to cut everything out. So it's like if you make it to 50 years old and you still have your tonsils, your appendix,
Gallbladder,
brain, you've made it.
Yeah. Let's talk about some causes for diabetes mellitus type 2. So honestly, this is a lifestyle cause. Being overweight and obesity is the number one cause for diabetes. And metabolic syndrome, if you've been told you have metabolic syndrome, this is what it is. It's a cluster of risk factors that increase the development of not only diabetes, but also heart disease and stroke. And so how they determine if you have metabolic syndrome is they will measure your waist. If you are a woman and you have a waist greater than 35 inches, you're a candidate for metabolic syndrome. If you are a man and your waist measures more than 40 inches, you are a candidate for metabolic syndrome. That's not the only thing. Also, your triglycerides, your cholesterol levels, they're going to look at your fasting blood sugar, your blood pressure.
Yeah, when they look at your lipid panel, they're going to want to make sure that your good cholesterol and the ratio between the good cholesterol and the bad cholesterol are healthy. It's very important. It's not always about the total, and it's not always about the bad cholesterol. When you see your primary care physician, they love to just say, oh, your total cholesterol's high or your LDL's too high, which is your bad cholesterol, but it's really about the ratios. If you have really good levels of good cholesterol, that will help counteract some of the slightly high or high levels of LDL, and you might not really have a problem. But when your blood pressure's high, your cholesterol's high, your blood sugar's high, that's the metabolic syndrome. That's pretty much the trio for it. And if you're not taking care of your system, then you're going to have diabetes.
Yeah. Lack of physical exercise. You have to get out there and move to get that body going. So thanks for tuning into Your Health is Wealth. We are from Naturopathic Physicians Group in Scottsdale, Arizona. We discuss a different topic about natural remedies for your health every week. And today we are talking about diabetes type 2.
Every single week I do a segment called What Isn't Your Doctor Telling You? And basically this is a very real one when it comes to conventional versus naturopathic medicine. Because when someone has diabetes on the conventional world, here's your drug, here's your insulin, here's your pump, whatever it is, it's never looking at the cause. I hear this from patients all the time. Like, yeah, my doctor said I should watch my diet. Okay, what'd they tell you about that? They just told me I'm supposed to watch it. So I'm thinking they're probably wearing bifocals as they're reading the ingredients on their next pastry. But basically, you have to be taught correctly on how to avoid diabetes and treat it correctly. Because in all honesty, diabetes, and tell me if you agree with me, Dr. Ryder, diabetes is a pretty easy thing to treat.
I would agree.
Until they're insulin dependent.
Yeah.
Once they start becoming insulin dependent, now you're dealing with a failed organ system with the pancreas, and it's much more complicated. Still treatable, but a much different thing. But when you're talking about diabetes in the pre-diabetic stage and even the early onset where you're talking about using medications that we'll go over in the next segment, it's not a difficult thing to treat if the patient's willing to do the work. So on the segment today, when we're doing What Isn't Your Doctor Telling You, I just want to tell you how addicting sugar is. Everybody's heard this before, but when you eat sugar or something sugary, whether it be the regular sugar or it be corn syrup, it runs the exact same pathway as cocaine. It's that addicting to our system. It stimulates dopamine, which is your pleasure sense in your brain. And then it also stimulates adrenaline, which is why people get a little bit of a sugar high and get a little bit of energy out of it. But then you get the sugar crash right after that. And because sugar metabolizes so quickly that your body burns through that energy fast and then you're tired again. But remember, sugar runs through the same pathway as cocaine. Now, a lot of people then say, what about the artificial sweeteners out there? Now, we've said on this show many times, artificial sweeteners are as bad or worse than the regular sugar, but there's technically not supposed to be anything in artificial sweeteners that does the same exact thing as sugar when it comes to addiction. However, that's not true because they add in there, and if you go read all the labels that say artificial sugar products, read the labels. It will say contains phenylalanine. Phenylalanine is an amino acid that stimulates dopamine, that pleasure sense again. So they artificially create these artificial sweeteners to stimulate that same cocaine addiction pathway that sugar does, and you become just as addicted to it. So on that note,
That's how they get you with the Diet Coke.
it's how they get you with the Diet Coke and any other diet product out there. They make it just as addicting as sugar, and it's not supposed to be that way.
Yeah. So let's go back to the metabolic syndrome measurements. We talked about waist circumference measurements, more than 40 inches for a man, more than 35 inches for a woman. If you have these risk factors, then metabolic syndrome is something that you need to take a look at. Triglyceride levels, if they're above 150, HDL is your good cholesterol. If it's above 40 in men and 50 in women, that's a factor. If your fasting blood sugar is above 100, that's a component. And also if you have a blood pressure of 130/85. So if you have any three of those, you will be diagnosed with metabolic syndrome.
And when you do the testing, that's important too. If you eat a big meal and then test your lipid panel and you test your sugar, it's going to go through the roof. So you want to be fasting before you do any of these tests. And again, the HDL good cholesterol, you want to be above 40 or 50, depending men or women. But those triglycerides, again, that's the fat in your blood. So when the triglycerides are high, just assume your blood has more fat in it. Assume it's going to be more sluggish, which is going to mean your blood flow is poor or not as efficient, which then increases your risk of those heart attack and stroke. But again, as I was saying earlier, this is not a difficult thing to treat if it's treated correctly. And if you're not exercising, but the number one reason why someone's going to have diabetes, you eat too much. And what you eat, that's inflammatory. You start inflaming the pancreas. When you eat too much, the pancreas gets stimulated to make more insulin. When it makes more insulin, which, by the way, insulin stores body fat. So if you're eating too much sugar, you're going to store a lot of fat, and then you're going to gain weight. Other causes can be naturally your pancreas might be not as efficient and not make as much insulin as well. So then you just got a negative all around at that point.
It's easy for us to sit here and say, diabetes is easy to treat. And you're the one there that has these overwhelming sugar cravings and you have body pain so you can't get up and move and exercise. We understand that. We get that all the time in the office. There are certain things you can do. You just take small steps at a time. But honestly, it comes down to how badly you want to change this for yourself. You can do it if it's a goal of yours.
Yeah, I'm not trying to oversimplify it by any stretch. Good call, because I probably sound mean. And I promise you, I'm not really mean. But the nature is when I say it's easy to treat is if you're putting in the effort and work and you're seeing the provider that understands the causation and you're willing to put in that work, you can get off those medications. You can get your life back and just feel better.
Let's talk about some traditional diagnostic tests that you may have done at your conventional doctor's office when they're searching for diabetes, if it's a factor in your life. So hemoglobin A1C, or just shortened as A1C, this measures your average blood sugar level over the past 2 or 3 months. If it's below 5.6, that's considered normal. If you're between 5.7 and 6.4, that's a pre-diabetes range. And then if it's above 6.5 or higher, that's diagnostic for diabetes.
And the absolute perfect time to start really preparing. You always want to be preventative, but if you're between that 5.7 and 6.4, that's the time you need to make those lifestyle changes before it turns into full-on diabetes, because that's, like I said, that's when the pancreas is really not working well and you become closer to insulin dependent, and then it becomes a lot more tricky. But this A1C is an absolute gold standard test for diabetes type 2. It's a gold standard because you have to monitor if the treatments are working. And just running your blood glucose level doesn't do that. The blood glucose level, like I said, changes every time you eat, and depending on what you ate will fluctuate. So the gold standard is that A1C because it's that measurement over 2 to 3 months.
Yep. We can also measure your fasting glucose. This is usually included in the comprehensive metabolic panel. This is fasting, which means you shouldn't have anything to eat after maybe 9 p.m. the night before. Just as a side note, please drink water the night before and the day of, because you want your veins to be nice and plump for that blood draw for everybody's sake. A fasting blood sugar level of 99 or lower is considered normal. Anything 100 to 125 is that pre-diabetic range, and anything over 126 is that diabetic marker.
Now, there's also issues when your blood sugar is too low, but that's a completely different thing, and we might talk about that on another day.
Yeah, good idea.
But the Chem panel, or the comprehensive metabolic panel that measures your fasting glucose, also measures your kidney function and your liver function. So those are things that are important to monitor, especially if you are diabetic as well. But the lipid panel, again, comorbidity with metabolic disorder, you want to make sure that your cholesterol levels are in check, because if they're not, then it does increase your risk of developing all of the above, including the diabetes.
Also, fasting insulin, I don't see many conventional doctors checking this, and I just question why, but it should be. And it measures how much insulin you have without food in your system. So this can determine if your body is actually prepared to intake sugar. It can also determine if you have become insulin dependent. So if your body is not making any insulin anymore.
I could do a whole "What Isn't Your Doctor" segment talking about fasting insulin as well.
Yeah.
Because oftentimes the range of your normal insulin on the lab, it's going to say 3 to I think it was at 24.9 or something. It's up to almost 25. But you really want to be in that 3 to 10 range, which is a really healthy range, because you don't want to be getting too high on that insulin level to just maintain your blood sugar. So again, it's about trends. You want to see how things look. If your insulin levels are going up and your blood sugar is staying the same or going up, that means your body has to produce more just to maintain those levels, which means your pancreas is working harder, which means you're creating a problem. These trends are so vital to your health, which is why we always say do your labs every year. And I'll still have people come in and say, I haven't done labs in 10 years. I'm like, you see a doctor? Yeah, he just doesn't think I need to run labs every year. I'm like, you can't see trends if you don't run those labs. But fasting insulin is a huge component to being able to not only prevent diabetes, because you can see where those insulin levels, if they keep creeping up just to maintain your blood sugar, that's a problem.
Yeah. There's also a glucose tolerance test that's sometimes done conventionally. This measures your blood sugar before and after you drink a liquid that contains glucose. So you'll fast overnight. Before the test, you have your blood drawn, and then you get the fasting blood sugar level before you drink it. Then you drink the stuff, get your levels checked maybe 1 or 2 hours afterward, and they'll see where your blood sugar level is. And then depending on the level there, it will indicate whether it's a pre-diabetes or a diabetes marker.
And a very rare one people run is called fructosamine. It's similar to that A1C, but that it only measures a couple weeks of your average blood sugar instead of the couple months. So the gold standard is still going to be that hemoglobin A1C, but there are some times where we want to see what's happening over a shorter period of time, especially if someone's doing a dietary change. We want to see some improvement faster than 3 months and not just say, hey, let's take a look at it in 3 months.
Dr. Ryder here with your tip of the week. So let's talk about snacking. If you snack often, or you feel like you must snack between meals, then your body's likely having some blood sugar control issues. So we have a function called the motor migrating complex. We'll just call it the MMC. So basically, it's electrical current that migrates through your stomach and intestines only when there's no food present. The MMC starts about an hour after we've eaten. It's basically our internal housekeeper. It cleans undigested food residue, intestinal cells that have been scraped off, any other elements that are left over after eating. So the longer the MMC is permitted to work, the cleaner the internal environment becomes. What disrupts the MMC? Eating, because it will have to wait until the next time that you've gone about an hour after eating for it to work again. So this affects our body's ability basically to regulate sugar and insulin. So what's the tip? It's to establish optimum blood sugar control. You're going to have to strive for at least 4 hours in between meals where there's no snacking, no drinking of sugary drinks, including fruit juice. So this is basically how our grandparents ate. They had breakfast, lunch, and dinner, and they really didn't have snacking in between. So this mindless couch sitting or computer sitting and snacking is killing us, and it's giving us diabetes.
They also had much cleaner food than we did too, because the amount of chemicals we use on our food is much higher too, which of course increases the risk of any of those chronic illnesses. But I hear people all the time, I eat 6-7 meals a day. They're all small meals, but you completely disrupt this MMC process. And I have other people that skip breakfast and lunch and only eat 1 meal a day. And I don't even know what to say on that.
Yeah.
It's just like you've got to have normal rhythms and normal patterns in your system. I'm not against intermittent fasting, and we'll talk more about that later, but it's not for everybody either, though. But you have to give your body normal rhythms. You have to allow your body to digest properly, and you've got to give your body the ability to use and all at appropriate times. We're creatures of habit. We're creatures of timing. Even half the processes or more in our body are paced. They're timed in our system. And if we keep disrupting that time, your body can't adjust appropriately.
Yeah. So let's talk about what happens if or when you may be diagnosed with type 2 diabetes. So you will be given a standard, this is through traditional conventional medical care, you will be given a standard glucose monitoring kit, typically a finger prick. Now, I know technology has advanced, and so they've gotten better at this, and you don't have to necessarily prick your finger every time, but this checks your blood glucose levels at any time throughout the day so that you can keep an eye on things.
Yeah, I knew so many people. I used to work in a pharmacy for years, and I used to see so many people that would pick up their insulin pens or insulin device equipment all the time, and you'd look at their fingers, and they would have calluses all over the fingers. It got to the point where it didn't even bother them anymore. They were so used to doing it, but it was definitely not what people want. The thing that most people, when they become, especially if they become insulin dependent, down the road, most people want to get the continuous glucose monitors now because they automatically track your level. And these are even smart now where they send them right to your phone. So you can pretty much see your blood sugar levels 24 hours a day if you want to. It also, a lot of them will have alarms that will go off if you're too low, or they'll go off if you're too high. And so you can then increase insulin to lower it if it gets too high. So it's a way to give you a lot more information a lot quicker without having to jab your finger every single time you want to. So patients with diabetes now have a lot more ability to pay attention to it, not always for the right reasons in a sense. A lot of times we use that as a way to eat more, and then they know how to mitigate that. But that being said, yeah.
Let's talk about traditional treatments when it comes to diabetes. So let's talk about some of the old school meds. The biguanides, making sure I'm pronouncing it right. I'm checking it with Mr. Pharmacy Tech over here.
Old school medications.
Yeah. So these medications decrease how much sugar your liver makes. So when they decrease how much sugar your intestines absorb also, it makes your body more sensitive to insulin and helps your muscles absorb glucose. So everybody's heard of metformin. This is in this category. And metformin, I can't really argue with. It's an oldie but goodie when it comes to diabetes. So the benefits of metformin are, if you've ever heard of PCOS, polycystic ovarian syndrome, so it helps with menstrual regulation, fertility, and elevated blood sugar. That's why it's given to diabetics. Metformin also helps with loss, and there are a significant amount of information out there on studies about longevity, which helps you live longer. And metformin has also been shown to decrease complications from cardiovascular disease.
So in a lot of the studies that deal with metformin, the longevity part of it is mainly because it's lowering your blood sugar levels. It's maintaining better blood sugar levels. And by doing that, you're going to have less chronic illness and less inflammation. The gold standard is still not to be on any of the medications for it, but this tends to be first-line therapy for most people with type 2 diabetes. There are some side effects with them. It will lower your folic acid level. So most people that are on metformin, if they're not monitoring their blood work, you might become low in folic acid. And of course, like any drug that lowers blood sugar, the biggest thing you got to be careful on is lowering your blood sugar too much. So dizziness, lightheaded, tremors, you can even faint if your blood sugar gets too low. And of course, people that faint can hit their head. So it does have some issues with it, and just be careful. Now, again, we're never telling anybody not to start or stop any medications or supplements or treatment plans. We're just giving you information so you can talk with your doctor about it. And if you don't have one, you can talk with us about it.
There are some other old meds in the list here. Sulfonylureas, they work by stimulating the pancreas with the help of beta cells. Now, you're going to recognize these maybe glimepiride and glyburide.
Yeah, the beta cells in your pancreas are what makes that insulin. So if you are not making enough, or if your beta cells are damaged, you don't make the insulin, and therefore you get diabetes. So those are not as common as the metformin, but they're pretty common themselves. There's also things called DPP4 inhibitors. So what is that? It's a really long word, so we're going to say DPP4 inhibitors. But this one allows the body to just make more insulin. As you'll see, a lot of the drugs, they're just newer versions of older mechanics. But this one, just like metformin in a sense, where its job is to help the body make more insulin to lower the blood sugar. But again, these drugs, again, the side effect, the biggest one is it can lower your blood sugar too much, and that can cause all of those issues with it.
This is a big and trending drug here, the GLP-1 receptor agonists. So these are drugs that are similar to the natural hormone called incretin. What they do is they increase beta cell growth and how much insulin your body uses. They are appetite suppressants. And they also they tell your body how much glucagon your body uses, not glucose, but glucagon. They also slow stomach emptying. So these are the injectables that we've all been hearing about that help people lose weight. So they are FDA approved for diabetes. That's what they are there for, because they help improve insulin resistance. But whenever you are suppressing an appetite, you're not going to eat as much, you're going to lose weight. Now, there are a slew of bad side effects and bad items that come along with this, but we don't have, that's a different podcast. But basically, you stay full longer, you lose weight, and you lower your blood sugar. And people with diabetes who have tried everything under the sun, I definitely approve of these GLP-1 receptor agonists. Now, if you are just trying to lose 10 or 15 pounds, I do not approve. There's that.
Yeah, and the big ones that on a different level, those the people that are always talking about these new drugs of Mounjaro, Ozempic, Wegovy, the semaglutide drugs. These were all peptides that naturopathic doctors were using for a long time until the pharmaceutical companies came in and said, oh, you shouldn't do that anymore because we want to make our money as a pharmaceutical company. But these drugs help with diabetes and help with appetite suppressant and help you lose weight, which is okay if it's done correctly, but you still don't want to use that as your end-all be-all because you got to treat the diabetes right so you don't get that kidney damage, you don't get those eye issues. So there's so many different drugs they use for this because each one, again, has a little bit different, though. We want to just finish this up, and one of the common ones now, or more common, are the SGLT2 inhibitors. Again, they love these big words. I don't like them. But basically, this one works by preventing the kidneys from holding on to that sugar. So this one can be a way to help drop the sugar as well. But in general, when you get to the point to where your diabetes is no longer being controlled with medication, now you're into insulin. And like I said, you're always better to try and fix your diabetes prior to getting to this point. But again, treating it with drugs does not fix the diabetes. It's monitoring your diabetes. It's making sure your sugar's okay. You have to treat the diabetes to get rid of the diabetes, or you're going to be on the medications for your whole life and eventually turn into insulin. So now we're going to talk a little bit more about the insulin.
Yeah, speaking of insulin, so it basically just lowers your blood sugar. So you have a rapid acting insulin. This starts working within 20 minutes. These are the injectables. They can last up to 5 hours. This type of insulin acts more quickly after a meal. So basically, it mimics the body's natural insulin, reducing the risk of low blood glucose. So when you use this type of insulin, you have to eat immediately or soon after you inject.
Yeah, these are going to be very common ones people use because they need to drop that sugar quickly. But then you also have the short-acting insulin. So this takes a little bit longer. This one usually takes about 30 minutes to kick in, and it'll last about 8 hours in your system. This one is known as Humulin or Humulin R. Humulin R, you're not going to use this if you need a quick drop, but this is one that people use these to try and give them a little bit of a break for a longer period of time. But what you're going to learn, the longer the insulin lasts, the more likely you're going to put yourself into a low blood sugar problem because they're always going to be using some of that insulin. So you have to monitor yourself either way, but the longer they act, the more likely you're going to drop too low.
Then you have the immediate acting insulin. This takes up to 90 minutes to kick in, but lasts up to 24 hours. This one is known as Humulin NPH.
And then, of course, long-acting ones. This just drops a little bit of insulin. It's a slow, steady release of insulin. Most people use these once a day, and that is called Lantus is the most common one there. But again, the side effects are most commonly low blood sugar. And if you are using insulin, a lot of times it's hard for you to lose weight because you're storing more body fat along the way.
Let's talk about insulin pens versus insulin pumps. So as far as pens goes, insulin companies have designed these disposable or reusable insulin pens to be used with their own brand of insulin. And there are cartridges that are used to dose the insulin into the patient.
And then those fancy pumps that people have now. When I worked in a pharmacy, I worked with a diabetic specialist pharmacist, and she was always telling me about a lot of what they were doing was hooking up pumps to people. And I asked her, what do you think about something like that? And she would be like, I hate them. She's like, because it's like an excuse. Now, again, I'm not trying to say it's an excuse either. You got to make sure your blood sugar is normal. She's like, but with the way the pumps are, is it has rapid acting insulin attached to the pump, and you could push a button to induce some more insulin and then lower your blood sugar. So she said the people she would see, they would use this as an excuse to eat a cookie or eat cake because they're like, okay, I'll have the cookie, have the cake. I'll just push this button, get a little more insulin in me, and my blood sugar's fine.
Aye.
So it was not helping people when it came to being able to hopefully be able to one day not need insulin anymore and get the diabetes under control. They used it as a way to control the blood sugar, not the diabetes. And so she was not a fan of these. But for people that have a hard time controlling and regulating their blood sugar, they can push that button and there's their insulin to lower the blood sugar. But again, you push it too much, automatically give yourself too much insulin and your blood sugar drops. So again, biggest side effect of the insulin is too low of blood sugar.
There is also surgeries for weight loss. And there's many different ways to go about this, but we'll just talk about the big one here is called the gastric bypass surgery. Now, this is typically reserved for severely overweight individuals, and it has shown as a possible treatment for type 2 diabetes. So gastric bypass surgery is the most effective therapy to treat type 2 diabetes, according to this research. Many achieve remission of diabetes following the surgery, and they no longer require diabetes medication. However, they don't treat the cause of the obesity to begin with, which is what naturopathic doctors are all about. And it also doesn't teach or train people how not to gain that weight back over time.
Yeah, there's a lot of restrictions to gastric bypass post-surgery, and a lot of times people lose the weight for a long period of time, but then it starts coming back because they were never taught the tools to maintain that weight loss. And it is a big problem for a lot of people. And then there's other people that do the surgery and they lose the weight and then they maintain that weight loss for the rest of their life. They do great with it, but there's definitely some issues. This is also one where if you're going to be doing a surgery like this, you want to do this before you're insulin dependent, because you're not going to fix the pancreas with this procedure. You're still going to have a problem. This is one that when you lose the weight before you become insulin dependent, oftentimes you can get that blood sugar regulated because you're no longer eating all of that sugar and you're losing all that weight. So gastric bypass has been shown in studies to be a cure for a lot of people with type 2 diabetes. But of course, that is individualized to how well do they follow the restricted diet post-surgery, as well as how long do they maintain that diet for so they don't gain that weight back.
I really do think that food counseling, diet counseling, lifestyle counseling should be something that is mandatory with that. I do think that if you're going through insurance, I feel as though insurance should pay for that because it only makes sense.
Insurance doesn't pay for things that make sense.
It only makes sense because in the long run, it's going to be more expensive for them anyway by dishing out these medications and paying for the medications if they haven't trained the individual the proper lifestyle and diet choices to make so that this doesn't continue to happen.
It's always driven me crazy as a practitioner on how little insurance helps people when it comes to long-term care and long-term preventative care, long-term healing capabilities, that they're okay with paying for your drug every single month for potentially the rest of your life, paying for surgeries, paying for every complication that comes with it. But God forbid they pay for anything that could potentially prevent the condition from getting worse.
Yeah.
On a naturopathic side, we run the same test to monitor your blood sugar and diabetes, but we also do a lot of testing to help you understand more of where this inflammation is coming from. What other things is your blood sugar issues causing in your body? Because if all you focus on is the blood sugar and the diabetes, you're missing the big picture. You don't develop metabolic syndrome overnight. This is something that takes years for most people to develop, and the amount of ramifications that has towards long-term well-being is endless. It's astronomical.
And this is something that naturopathic physicians are pretty darn good at, is trends, catching trends, because you have to have a baseline somewhere. And once you have that baseline, then throughout the years, you just build on that. That way you can see, hey, is your kidney function decreasing over time? Hey, is your glucose increasing? It might be normal, but is it going up each time you check it? These are all just early windows into what's going on inside your body so that you can catch something early, do something minor about it, make some little tiny shifts so that you don't have this major problem at the end result of a diabetes picture.
Yeah, and if all your doctor wants to do is give you drugs, just assume you're on those drugs for your life. And if that's something that you're not interested in, again, talk with somebody who knows how to try and figure out and prevent it moving forward. So diabetes is a massive topic, and it's one of the most common things in this country. So we wanted to break this into a two-part segment where we talk about the conventional this week, and next week we're going to talk all about the natural stuff that we do for people with diabetes to help them get off those meds and live a great, healthy life.